Hello and welcome to the Eric and Liz show at 401 sharp today. And today we're going to speak about Cancer Awareness Month. And for that, I welcome with me today Jen Millinger. And what happened? Yeah, she is coming. It's good. Unfortunately, Liz today won't be with us. Her son is in town and they had many plans. And, sometimes life takes over and, well, she will not be with me on the show. But I guess I still will survive. And just to see, Jen, are you on board?
I am here.
Hello, Jen. Hi.
Hello.
I can hear you. I can't see you yet.
Well, that's because I was trying to send you my resume here. Can you see me yet?
Nope.
This is my fourth Zoom meeting today. So some of them they wanted to see me, some they haven't. So.
Well, okay. Well, I think we have you now. And yeah, since it is, Breast Cancer Awareness Month, and we happen to be, October 1st, I found it really, I was looking for someone to have on the show, and suddenly, you came across my horizon, and you are actually dealing, with breast cancer patients. So one of the things I just wanted you to tell our viewers, of course, who are you? Then maybe also what you do, of course, and some of your more interesting hobbies that you have. And that, let's jump in afterwards, in the different type of breast cancers and, what people have to wait and what they have to look out for. So Jen, to you.
I'm Jan Millinger. I'm a licensed marriage and family therapist in the state of California. I've been licensed for 34 years. And post-license, I worked at the AIDS Project. I worked for the American Cancer Society. I worked for hospice. And then I spent 23 years in a hospital emergency room. Yeah. I've retired from that now, but I'm seeing patients on telehealth right now. I do have an office, but telehealth right now. So I have long specialized in people dealing with trauma, death, and diagnoses that are frightening. So here I am. Oh, interesting hobbies. Cats, yeah. Quilting, cooking.
Quilting, cooking, yeah. And you do that quite extensively. So how many cats do you have currently?
Eric, you've asked me that for years and I've never told you, and I'm not telling you right now.
Okay. Over 10.
Yeah.
Okay.
I am the crazy cat lady. This is me.
That's that. Yeah, I know. Well, let's turn because it's breast cancer awareness month. Let's turn to really how serious is breast cancer? Do you feel that it's something that people are a little nonchalant about it, don't take it that serious? Is it something which often just pops up in people's life because they didn't do, pre-cancer screening, etc.? How do you see the situation?
Well, cancer is a serious diagnosis, whether it's stage 1 or stage 4. Stage 1 is early, where it's located wherever it starts, and then as it spreads out from that, it becomes stage 4. I think the education for breast cancer in the last 20 years has been fabulous. I think there's a lot more conversation about it. I think there's a lot more people that are aware of what the symptoms are, or the no symptoms, but are getting their mammograms and screenings at the intervals that their doctors recommend. And you know, if you have a family history of breast cancer, especially a first-degree relative, mother, father, sister, brother, then your risk factors go up. You can
So
always
just let me come back to that and maybe emphasize that point. You know, that if you had someone in your family who had breast cancer, you're just statistically more likely to get it yourself.
Yeah, I mean, again, the screening becomes very important. Work with your doctor on what interval they want you to have. And you notice I said mothers, fathers,
Yep.
sisters, brothers. 1% of breast cancer cases are in men. It's really not discussed that much. It's kind of probably embarrassing for men to have a diagnosis of breast cancer because so many people think it's a woman's only disease. It is not. So men, if you're having any symptoms, or again, if you have a family history, talk to your doctor about what they are going to recommend for you for screening.
Yeah. So at what age is it sensible to go and say have mammogram?
Well, the American Cancer Society has guidelines. Your doctor has guidelines. I'd follow what your doctor says. I've worked with breast cancer patients in their 20s. So,
Yeah.
you know, most people think it's just an old lady disease, and it's not either. It's not just old, and it's not just ladies. So you just need to be aware that, you know, keep in close contact with your doctor. There's self-examinations for both men and women. You can get those guidelines from the American Cancer Society. So doing self-exams, and then, you know, having your annual physical, your doctor can do the exam too. Because a lot of breast cancers are found on mammograms. My sister was diagnosed as a result of a routine mammogram. She wasn't having any symptoms, so they caught it very early, and she is doing great.
So apparently there is 3 different types of I don't want to say breast cancers, but what they do actually to your breast to remove the cancer.
Well, there's generally three types of surgery that they can do. There's also chemotherapy and radiation therapy, and sometimes they're used in conjunction with each other. It depends on, you know, the oncology doctor that's doing the treatment, what stage your cancer is, a lot of factors. Now they've, you know, in the last several years, they've discovered about hormone receptivity, and so that can help detect if it's a familial line or if it's just an individual genetic mutation. So the 3 main types of surgery for breast cancer, if surgery's in the outing, is lumpectomy, where the doctors will generally do an ultrasound or something and localize where that tumor is, and go and kind of, I'm going to say scoop it out. That's not the right terminology, but sort of get it, you know, get the tissues surrounding it out, as well as the tumor. Mastectomy is a removal of the breast, all of the breast tissue, and a radical mastectomy is removal of the muscles, the pectoralis muscles underneath the breast. Again, it depends on if it's spread, if it's not spread, sort of where it is. So, you know, the treatment's very individualized to the person who has the cancer and the type of cancer that it is. It's really very interesting because right now, 1A, 1B, 1C, I don't know all the specifics of that, but for some of the very low, newer, small tumors, they're often called in situ, which means that they're just in that one spot. There's some countries now that aren't even treating them. There's a lot of research going on right now that looks at, because some of the thinking in cancer treatment right now is we all have cancer cells in our bodies at any given time, and that some people their immune system kills the cancer cells, other people it doesn't. So it's thought with all of the, with a lot of the cancers in situ, I'm thinking of Switzerland in particular.
Yeah.
They're not going to treat a stage 1 cancer. They're just going to watch it very carefully. And they find that a lot of them just disappear.
Wow.
Yeah.
That is a pretty, I mean, I know that with, for men with prostata patients, they're going down that road because they're saying that most of the time is such a slow evolving cancer that the patients basically outlives, you know, the time span where it could be dying, and that doing that invasive surgery could be actually more dangerous to the patient than, you know, just watching it.
Yeah, I mean, it's all being researched as we speak. And so I'm not up on necessarily the latest research, but that's, that's the last that I understood. So,
Well, yeah, I mean, you're on the other, you're on a different side here. You know, you're not the doctor which actually treats, you know, the cancer, but you are the therapist who goes along and navigates psychologically the illness with the patient.
so first off, we talk about early diagnosis is better. People have better outcomes generally if you're diagnosed early. The thing that keeps people from being diagnosed is fear, usually. They may have a symptom, they may not have a symptom. I mean, I've seen pictures of a breast cancer tumor that's ruptured out through the skin, and it's just this huge tumor now. By then it's probably spread throughout most of the body. And the people who don't go get things like that checked are generally fearful or in denial. So the thing is, if you have any suspicions and you just get your regular exams, then they're more likely to find it earlier. But the thing with anything with your health, don't let fear stop you from getting it checked and diagnosed. You need to make sure to have a good communication with your physician. Let them know things that you have concerns about. Let them know your family history, so that, you know, you can call them up and say, hey doc, there's this going on or that going on. What do you want me to do about that?
Yeah.
And I think it's just really important to make sure that you don't ignore the early symptoms. So I understand the fear, and a lot of people's reaction to fear in that sense is to ignore, is to just shove it under the carpet, pretend it's not there. And that's not going to be in your best interest for your treatment and for later on.
Yeah. So what I think is important to say there too, there's no age factor, and I really want to put that out there. You know, there is no early or late, you know, for having breast cancer. It can just occur in the early 20s, like much later in life, I guess. And yeah, it's true what you're saying. Don't ignore your body. You know, there are signs, and if there is, like there is, you do your self breast exam and you feel suddenly there is a lump, you know, which wasn't there the month before, then, you know, there's nothing wrong with going to the doctor and being diagnosed. I mean, worst case scenario, it's something benign. Okay.
Right, exactly. And then your mind's more at ease, because not knowing actually is more stressful generally than knowing, because once you know what's going on, you can start to deal with it. Not knowing, your mind creates all these different scenarios that usually have you dying within the next 5 minutes. So it's just best to get an answer,
Yeah.
so that you know what's going on, you'll know what your options are, and your chance of recovery are going to be better. So by the time that I see people, it's generally they're they're in treatment, and they may have gone through a lot of treatment. Sad to say, many breast cancers recur 10, 20 years later.
Yeah.
There's women now who are doing palliative bilateral mastectomies. So if they have breast cancer in one breast, they have the other breast removed just to try and minimize their risk factors. Again, that's up to you and your doctor. But oftentimes, family members don't really understand. Friends don't know what to say, so they stop calling you. There's the initial people who want to bring a casserole over and take your kids or do whatever that needs to happen. But getting to be able to talk about what you're going through, talk about the fear, talk about what you're feeling, that's really important for people to be able to process it.
I know, Jen, there's not something like a 5-minute therapy. You know, I think sometimes people just, go to a therapist, you have one session and it's over. No, it's not. I mean, it's something which is a long drawn out process. And I think it's also, that trust between your therapist and yourself has to be built. But what could you recommend to someone who is experiencing that fear and now thinks, I think there is something wrong with me, but I really don't want to go to the doctor, but I should. Is there anything, that person by itself can do, or should they really just pick up the phone and, hey, I'm asking for help?
Well, again, people need to know that not knowing can be way more stressful than knowing. So, because in your mind, you create the worst possible scenario, and it may not be the worst possible scenario. So it's better to find out for sure what's going on than to build this whole scene in your mind that is going to just freak you out, and etc. I want to talk briefly too about partners of people with breast cancer. I'm going to be speaking mainly of women that have breast cancer here, that sometimes their partners don't know what to do. I've had clients whose husbands have divorced them or their partners have left them because they've had a mastectomy. And, I just think, that's not a good thing. But just to have that also thought over your head, you have somebody who's willing to walk this walk with you. Because, sometimes it's, you don't have your breasts anymore, that's why I fell in love with you, or just a variety of statements like that.
Well, I know your opinion on those issues.
You think because I rolled my eyes? Yeah.
Sorry. I mean, this is, it's really very, very serious. But when you really think about it, it's true. In a partnership, that should be a non-issue. But it's not. It's very, very real.
Yeah. Should is not a word that I use very often, because if things were the way that they should be in my world, things would be very different in the world. So the only person that I can change is me. The only thing I can do is try and open up avenues for you to think about what you want for yourself, how you want to deal with things. But I think it's just really important to remember this is not a normal time. It's a very stressful time. Your cancer partner might be a friend. It might be somebody that you meet at one of the cancer support groups. There's a lot of wonderful cancer support groups right now. Two that come to mind are at the Navy Hospital and through SHARP. And I know that there's more of them out there.
Yeah.
But just to be with other people who have received that same diagnosis that's very frightening is often very beneficial. And the support that people receive there is just, I'm not alone here. I'm with other people who understand this. So like I said, maybe your initial reaction is to crawl into your shell and hide. but that's not going to benefit you physically or emotionally down the road. You know, you got to pull on your big girl or big boy panties and find out what's really going on and find out what your options are.
So apparently now, you know, you're not affiliated with any hospital anymore and so on, but you are self-employed basically. And is there a particular time where you would say people should reach out to you, or is it, you know, depending of the individual? Would you say, is it when someone is diagnosed and has immense fear, or is it someone, okay, went through the surgery, but suddenly, you know, the world is crumbling?
Well, again, should is not in my vocabulary.
Yeah.
So, I mean,
Sorry, when?
I see people from pre-diagnosis to I'm so scared I can't really follow up until, you know, either their treatment is finished or, you know, their prognosis may not be good. And I see them then, and then I'll see their families as well. So it's really a personal decision. Some people have excellent support and may not need a therapist. Some people may have better coping skills than other people and know how to deal with situations that are frightening to them. It just really depends on the individual's coping skills, their ability to, you know, look at what's going on rather than burying their heads. So, like I said, I see people from before the beginning to the end. So,
yeah. So how best to reach you?
How best to reach me? That's a good question. My office number is 619-552-7023. And I do have an office in Chula Vista, but right now I am doing all telehealth.
Yeah.
And that works out very well if somebody's not feeling well and doesn't feel like they can get up and get dressed and come to the office and that sort of thing. I can see them while they're in bed, that's fine. Yeah. So it's just, if you feel like you need support, please reach out. The Cancer Society is a good resource for material and information. So you can call them, they'll send you packets of information. Talking to friends, if you have friends that you could talk about this with your partner, if you have a partner that's willing to talk about it, or a licensed therapist.
Well, Jen, thank you so much, you know, for being on the show. That was very insightful, and you know, people just, I think they just underestimate what a therapist can bring actually to the table and help you to go through a hard time in your life where your partner just have to struggle through, you know, because it's so outside of your scope. And if you have someone, you know, who can help you better understand the situation, and usually there is a way out.
Absolutely.
And even if there isn't a way out and you reach that final point, which sometimes happen, unfortunately, a good friend of mine passed away 4 or 5 years, and she had survived brain cancer like 3 times, and then unfortunately died of a totally different cancer. But people can help you to be there till the very end, and at least, gosh, it's unpleasant. There's nothing pleasant here, but which just mentally helps you to get through it.
Right, because nobody knows really how much time we have left. I mean, I always say I don't know if there's a bus out there with my name on it or a cancer or whatever. There's something.
5 buses out there with your name on it.
Yeah, because the first one wouldn't get me. But anyway, just, you know, I just encourage everybody to not live in fear. Whatever your issue is, work with somebody, be it a friend, a therapist, whatever, so that you're just not living in fear and anxiety, because that's not a very pleasant way to live. So, you know, it's hard. I'm going to tell you too that there's therapists that you'll love, therapists you'll hate. We all have our different styles. We have our different ways of working with people. So if you go somewhere and you don't like your first therapist, see another one. And I'm saying I'm saying if people have Medicare, Medi-Cal, whatever their insurance is, then, you know, there's options for different therapists. If you're uninsured, which at this point in time, nobody should be, but if you're uninsured, then there are clinics that will see you. So just don't give up, people. Talk about it. Get yourself some support. Get somebody that's going to be some wind beneath your wings and help you deal with it. It's a very scary time, and there's people willing to walk with you through that.
Well, Jen, again, thank you so much for your time. You know, and I hope that some of our viewers or all our viewers really will take that, you know, to heart. It's to heart. And well, it's so important. It's so important, and so many lives can be saved. You know, people suddenly don't. They sometimes just don't realize the earlier you catch it, the higher are your survival chances. So we try to sit it out. You know, you can't sit out cancer.
You can, you'll just have probably less time to sit.
Yeah, yeah, that's yeah, and it gets painful.
So Eric, I thank you so much for having me on your show.
Oh, you're welcome. And I would have, you know, loved to have Lizz on it too, but you know, her son is here, and he's actually, it's a very interesting story. He's actually a firefighter in the Middle East.
Oh my goodness.
And
well, thanks to him.
It's pretty interesting how wives sometimes throw us things, you know. He you know, he's an African American, you know, who ended up in the Middle East fighting fires.
Okay. Well, I thank all of the first responders out there. I figure I'm kind of a second responder. But the first responders are the ones who really have to help people get to the right place that they need to be.
Yeah.
And hopefully, if you're facing something, like I say, that you're fearful of or just feel alone, then get in touch with the second responder.
Yeah. Jen, well, thank you so much again. And well, I guess I see you soon.
Okay. Thank you, Eric.
You're welcome. Well, yeah, so that was Jen Millinger, and I'm going to post actually her information, you know, at the end of the show. So you will have it. So Jen, I see you're still there. So don't forget me to get all the information I need so people can get hold of you. And well, next show, we're going to go into senior living, which I know for our viewership is more interesting. That's how selective our viewership is. Yeah, we are talking about senior living. So you can never prepare yourself early enough, and you would be surprised what bargains are out there. And just as a little takeaway for right now, if you are actually living in a trailer park, you should really watch next session. You would be surprised how affordable senior living is, and then you don't have to be afraid that there is nobody taking care of you. You will be taken care of, and that's what's important for now. So see you next week. Thank you again, Jan.
Thank you. Bye-bye.
Bye.